Okay, so NPR received a report about the standard of health care for women in Louisiana. And Louisiana, for those who don't know, have a near total ban on abortion. And a lot of people just do not understand how this could affect anything other than abortion. But that's because, despite people, advocates explaining that this isn't just about an abortion, this is what happens when you don't listen to people who actually know what the hell they're talking about. So anyway, this article is titled, Standard Pregnancy Care is Now Dangerously Disrupted in Louisiana, Report Reveals. In the wake of Louisiana's abortion ban, pregnant women have been given risky, unnecessary surgeries, denied swift treatment for miscarriages and ectopic pregnancies. Why I have a hard time with that word, I will never know. And forced to wait until their life is at risk before getting an abortion, according to a new report first made available to NPR. I would love to know who commissioned this report, but maybe we'll get to that later. It found doctors are using extreme caution to avoid even the appearance of providing an abortion procedure. Well, yeah. I mean, I can't imagine what it must feel like to not being able to practice medicine to the best of your ability, because you never know what you do that someone is going to have a problem with. Doctors should not be put in that position. Doctors should be allowed to practice medicine. You want to oversee? Fine. Go onto a state medical board, and then you can oversee it, or the local hospital ethics committee. If you're so freaking afraid that doctors are being doctors, do that. But politicians should not be putting doctors in a position being afraid to practice medicine just because these politicians don't know what the hell they're talking about. All right. We were stunned by just how much regular medical practice for pregnant people have been disrupted, says Michelle Heisler, the medical director of Physicians for Human Rights and one of the report's authors. The report draws on interviews with 30 healthcare providers and 13 patients conducted in 2023 and was jointly supported by 4 groups that support abortion access: Physicians for Human Rights, the Center for Reproductive Rights, Lift Louisiana, and Reproductive Health Impact. It's among the most comprehensive research to date showing abortion bans are changing pregnancy care and worsening maternal health. It concludes that Louisiana's ban is impeding a federal law that regulates the provision of emergency health care and is infringing on reproductive and human rights. Which again, people saw this coming. People mentioned why this could be detrimental, and those people who claim to be pro-life ignored it because their idea of life is very specific, I guess. There are going to be deaths that didn't have to happen. Exactly. There are going to be severe complications that didn't have to happen, said Dr. Nicole Freehill, a New Orleans OBGYN interviewed for the report. And exactly. And people have been saying this. People who know what goes into reproductive health care have been saying all these things. And people who just are thinking, ooh, abortion bad, because think of the poor baby who apparently it's bad to take away its choice to not be born, but obviously it must choose to be born as the default, which I find to be really bizarre. I mean, okay, so the fetus has no choice, but they didn't have a choice to become a fetus in the first place. Ugh. In one of the most extreme examples of how pregnancy care has changed, doctors described cases of women who experience preterm premature rupture of membranes, which is when the water breaks early in pregnancy before the fetus is viable. Some of these Some of these women were forced to undergo cesarean section surgeries to empty their uterus and avoid infection, instead of receiving an abortion procedure or medication. Because that's so much better. That's great that these pro-life people care so much about the fetus and the pregnant mother that they're putting women in danger. Can we just call it for what it is? These people think women need to be punished for daring to get pregnant because in their warped little brains, women who get pregnant and then need an abortion must be sluts. Because no good woman who has a family and got pregnant by her husband, no, none of those women ever need medical care. No, it's just the sluts that need it. Can we finally admit that this is just to punish women? Because of what a bunch of men, and yes, it's mostly men, there are some women who believe this bullshit, but it's mostly men, think that goes into why women need abortions. Because apparently abortion is a want and not a need, according to these dipshits. But then again, these are the same dipshits who think ectopic pregnancies can be replanted into the uterus. So we're not dealing with the smartest people. Okay, which is ludicrous. Absolutely ludicrous, said Freehill. The least safe thing that we do, no matter if it's early in pregnancy or full term at your due date, is a C-section. Which is why it used to be that medical practice was, the best medical practice was that once you have a C-section, you have to have C-sections for all your pregnancies. And they are now realizing that that is not the case. And that's probably along with the fact that C-sections are dangerous. They're not safe. So, well, the least safe. Not that it's unsafe. Let's put it that way. Describing one of these cases, Dr. Michelle Heisler with Physicians for Human Rights explained that the C-section was done to preserve the appearance of not doing an abortion. I mean, that's just so messed up. They are given this medical procedure, which is actually more invasive. My understanding is it's more invasive than an actual abortion. Just so they don't even look like they're performing an abortion. That is just crazy. The patient wasn't given a choice, she added. Exactly, because those who claim to be pro-life only care about the choice of the fetus, which isn't actually a choice at all. A C-section is major abdominal surgery. NPR consulted 3 OBGYNs who were not interviewed for the report, all of whom said a C-section in a case like this is not standard care. Compared to an abortion procedure or an induction, It carries far greater risks for increased hemorrhaging, compromised future fertility, and other complications. So there you go. Having an abortion is less of a deal than a C-section. But doctors are being forced to perform C-sections because of the fear of what will happen if someone nags them for having an abortion. Ugh! And who suffers? The woman. But, again, a lot. Now, I'm not going to say all, because there was that one Republican lawmaker in, I think, Idaho, who, once he realized just how far this goes, suddenly was like, oh, I guess I shouldn't have done that. Now, granted, they should have probably listened to experts to begin with, but hey, as long as they realize their mistakes, that's an improvement. But I wonder how many of these numbnuts in Louisiana actually care about these mistakes. The doctors also added that patients undergoing a C-section in that circumstance would be told that in future pregnancies they couldn't deliver vaginally and risked a ruptured uterus. Oh, so they still do that. I thought that they changed that, but yeah, that's just awesome. I want to emphasize that this is not what's in the best interest of the patient. No shit, said one New Orleans OB-GYN who didn't want her name used because she feared talking publicly would cause her trouble with her employer. That's fair. Sad, but fair. This is what's in the best interest of the physician in protecting themselves from criminal prosecution, which is, again, true. Physicians shouldn't have to make the decision, do they want to go to jail or do they want to give the woman the best health care they could possibly get? They shouldn't have to make that decision. And granted, I wish doctors would have more of a spine and risk jail time or whatever is the penalty. But at the same time, you really can't blame them. I mean, I certainly wouldn't want to go to jail for something that I could, find a workaround with. Granted, the workaround seriously sucks, but I do get it. Doctors face penalties under Louisiana's abortion ban of up to 15 years in prison and $200,000 in fines. Oh, well, then, yeah, I totally get why these doctors are playing Russian roulette with women's lives, because, this would definitely destroy theirs. So it sucks that they have to decide between their lives and their patients. But again, understandable. In what doctors described as another serious deviation from standard medical practice, OBGYNs in Louisiana are now delaying routine prenatal care until patients reach 12 weeks of pregnancy, the point at which the risk of a miscarriage drops significantly. One patient interviewed in the report said several different doctors' offices wouldn't see her before 12 weeks. One office told her the abortion ban was something that's new and that doctors wanted to eliminate some of the spontaneous abortions or miscarriages that may happen up until that 12-week mark, the patient recounted. I think physicians are scared, and so what we can do to decrease our risk that the Attorney General is going to come after us, said Dr. Nilima Sukabasi, a Baton Rouge OB-GYN interviewed in the report. And that is probably one of the things that they saw would be easiest. Which is just, doctors should not be put in that position. Let doctors practice medicine. If they are shown to be incompetent in practicing medicine, that's a different story. But when standard practice that experts agree is is proper health care, when you decide that is not correct, despite knowing fuck all about medicine. No, that's not all right. Delaying pregnancy care into the second trimester can be dangerous for people who might have complications such as a history of blood clots or an ectopic pregnancy that goes undiagnosed, doctors told NPR. Ooh. If I had a uterus, my uterus would be cramping right now. Ooh. Without treatment, some pregnancy-related problems can lead to birth defects, stroke, heart attack, or even death. Yeah, that sounds fun. And people were so worried about just back alley abortions. It sounds like it's just bad overall. Physicians are also delaying treatment of miscarriage and ectopic pregnancy out of fear of breaking the law, the report found. As previously reported in news stories from states operating under abortion bans, ectopic pregnancies, when the embryo implants outside of the uterus, are never viable and they can even be deadly. But, the people who are passing these bans, A, have no clue, or B, don't give a shit. I mean, we are talking about a party who, again, there are people who think that ectopic pregnancies can be reimplanted into the uterus. So that tells you the level of health knowledge that these people possess. One patient with an ectopic pregnancy said her care was delayed so long that her fallopian tubes ruptured. I don't even want to think about that. Like I said, this area is in pain right now. I could have died, she said in the report. I really could have died. In another case, Sukavashi had a patient in her first trimester who came to the hospital bleeding and in pain. The patient wanted an abortion procedure called dilation and curettage, or DNC, which uses suction to empty the contents of the uterus and stop the pain and bleeding. I know this pregnancy is not going to make it anywhere near survival, and I was stopped from taking her to the operating room. Sukavashi said, "Oh wow, I cannot read today." The woman waited for hours while hospital officials decided if abortion was allowed. Sukavashi said it all goes back to fear. Exactly, of course they're afraid. It's either perform an abortion and you go to jail, or not perform an abortion and your patient dies. I mean, so of course, they're going to be afraid. And I would love to see if any of these politicians are reading this report and if it moves them at all, or if, like I said, they don't care. Institutions don't want the government coming down on them, accusing us of doing something wrong when what we're doing is just providing essential health care that people are coming to us for, she said. Exactly. Let doctors practice medicine. I do not understand why you're acting this way. I really don't. Like I said, I don't know if it's to punish the woman for daring to get pregnant and needing an abortion because they think that only sluts need those, or whether they are so religious that their religion tells them that no abortion is allowed. Even though there is a recipe in the Bible for an abortion. So, yeah. Alright, where was I? When miscarrying women arrive at ERs in rural areas, Those rural hospitals are increasingly transferring patients to urban specialty hospitals, the report found, to avoid having to treat those patients altogether. But refusing miscarriage treatment could be a violation of the Emergency Medical Treatment and Labor Act, or EMTALA. EMTALA, I guess you pronounce it, a federal law requiring emergency medical care. The doctors described numerous cases in the report in which seriously ill patients were denied abortions until they became so sick that their lives were irrefutably at risk. That is just so messed up. Women shouldn't have to be near death in order to get medical care. You literally do not do that for any other condition. I mean, I just don't understand why this is such a special case. These included pregnant women with cancer, patients with heart problems and kidney failure, who were on dialysis and hospitalized, and women who'd experienced life-threatening complications from previous pregnancies and found themselves pregnant again. It's almost like women and doctors know better than anybody else what their bodies can and cannot deal with. Wow. In one case, an OBGYN treating a patient with severe heart failure was first required to prescribe multiple cardiac medicines before being allowed to offer an abortion. That is just so messed up. And I'm thinking, but what if she doesn't want to wait that long because she could have a heart attack and die? The OBGYN said. At what point can you act? How many cardiac meds have to fail? And that's not even getting into the side effects of the meds themselves. Another physician in the report couldn't get their colleagues to agree to an abortion for a patient with a history of multiple C-sections, hemorrhaging, and infections in past pregnancies. Oh my God. It was a risk to require the patient to stay pregnant, the physician said, but the woman wasn't yet at the brink of death. Wow. You know, earlier I did a video about how Republicans are blaming this on misinformation and doctors basically being stupid, that they don't understand what the law says. No, they know how to read English. Just because you made it so ambiguous does not mean that it's the doctors who don't understand what's going on. And this is the result. Some hospitals have even told physicians that they can't give patients any information on how to get an abortion outside of Louisiana because that advice could be construed as providing an abortion. Oh, wow. You can't even give out information. Yeah, because nothing bad ever happened when you withheld information from people. Louisiana's ban allows for abortion in cases of severe fetal anomalies, but only if those anomalies are on a list of conditions published by the state's health department. Well, at least they have supposedly experts compiling this list, so at least that. Women whose fetuses are diagnosed with severe and even fatal conditions that don't appear on that list are also being told they can't get an abortion, the report found. Oh, wow. So, yeah. Of course it's not going to be comprehensive because even experts aren't going to think of everything. If these people even are experts. I mean, who knows who within the health department compiled the list. Doctors said patients who can afford to are traveling out of state for abortions, while those who can't remain pregnant. Which, yeah, we knew that from less severe severe cases that's happening. Physicians interviewed in the report and those interviewed separately by NPR agreed that women's health and their lives were being put at risk because of the abortion ban, especially black and low-income women. And that's basically because those people can travel outside of the state to get an abortion for whatever reason. I assume it's because black women in Louisiana tend to be low income, which makes me question why you're putting black as a separate category. I mean, what other reason would they have for not leaving the state for an abortion? I mean, I do understand that, this was a big thing in COVID, that there are black people because of all the horrible experiments that were done in the 50s and 60s, that they don't trust medical experts, which I can't say I blame them, but if you're already seeing a physician, I don't know, I'm missing something. Louisiana let's try that again. Louisiana already suffers from some of the highest rates of maternal mortality and morbidity in the nation. Black women in the state are more than twice as likely to die as a result of their pregnancy as white women. Nearly 2/3 of maternal deaths in Louisiana are among low-income women on Medicaid. Some doctors in the report said that they have considered leaving Louisiana. Others warned that a possible exodus of OBGYNs would exacerbate the state's existing shortage of obstetricians. Well, yeah, of course it's going to exacerbate the situation, but I don't blame doctors for wanting to leave Louisiana. You want to be able to practice somewhere where you can practice medicine and not have Big Brother looking over your shoulder to make sure that you're doing what you're supposed to be doing, even though Big Brother doesn't know jack about what that should actually entail. And I'm not surprised that most of the women in Louisiana are on Medicaid and are low income. I mean, those areas probably don't have well-stocked hospitals either, which just exacerbates the problem. So it's just a mess. All right. Oh boy, let's see what the dipshits have to say about this. Louisiana Right to Life, which helped author Louisiana's ban, declined to comment on the report or specific medical cases. Of course they declined, because then they would have to come face to face with the consequences of their actions, of what they did, and can't have that. I mean, then they might have to, I don't know, they might actually have to develop empathy and feel bad for the situation that they ended up engineering. But, it's easier to just ignore the problem than to face facts that you caused a huge, huge clusterfuck. Its executive director, Benjamin Clapper, told NPR that the law clearly allows for the treatment of miscarriages and that the OBGYNs contacted by his organization have seen no change in miscarriage care as a result of the ban. Why do I feel that is not the case? Either he's making shit up out of whole cloth, but considering their reasoning for why they think abortion should be banned is basically making shit up out of whole cloth, that wouldn't be surprising. Or maybe maybe there are some people who are just risking it and providing the care. And he's just like, doop-de-doop-de-doo, we see nothing. Who knows? Clapper has said previously, in response to claims that the law is harming women's health, that these concerns have been manufactured by abortion rights supporters. No, no, this is a reality, and the fact that you only talked about miscarriage shows how little you know or give a shit about. The report's authors said they had simply documented the facts on the ground. The anti-abortion movement in Louisiana has for decades created a culture of harassment and intimidation of people providing abortion care, said Michelle Ehrenberg, the executive director of Lift Louisiana. And so for folks in that movement to now say, well, providers are just over-complying with the law, or they're misunderstanding the law. No, they are terrified. Now, considering this is the same movement who thinks it's perfectly fine to harass women who are just going in for health care, and they just happen to be pregnant, and so these people assume you're having an abortion and assume that they must be having an abortion for petty reasons as opposed to, reasons that are justified. I mean, of course they're not going to care about the results of this ban and claim that people are exaggerating, because they don't want to accept that they might actually be hurting the very people they claim that they're helping. Beyond going to prison, she said, doctors fear being harassed or ostracized from the institutions where they work and the communities in which they live. And all of that is a legitimate fear, she said. So that is the end of that article. So again, the fact that this has come to such a head should come as a surprise to absolutely nobody who was campaigning against abortion bans, because they know better than the politicians, and physicians know the best. So maybe listen to them. And like I said, this anti-abortion activist, this executive director, the fact that all he asked about was miscarriage shows that he doesn't fully comprehend just how far this goes. So, yeah, I really feel for the women of Louisiana, and I would not be surprised if there's a mass exodus and Louisiana goes even further downhill when it comes to every metric possible. Because their best and brightest have left the state because they don't want to deal with the state's bullshit. Anyway, like I said, that is the end of the article. So I will see you guys in the next one.